always happy to be with you on weekly basis. This week, we want to attend to the questions that we could not attend to last week. And many more that came in, we'll also take some of them. Did you remember to always wash your hands? What about the social distance? Were you able to achieve that? What were those things we are not able to do as respects the current health situation? I'm sure this week you'll try and do that. Stay healthy always. Now the first question is coming in from Osun State, and that is from Kemi. The question has to do, my daughter is 16 years old and she has no breast. What is the cause and treatment? Well, I don't particularly know what you mean. Is it that there are no evidence that the breast is coming? Or is it that the breasts are not big enough the way you expect of her age group? How do you measure if she's not having breast? And what about her menses? Has she started? So some persons actually get into developing secondary sexual characteristics like having the menses, pubic hair, and the breast. And you also want to find out, you as the mother, at what age did you see your period? At what age did you actually develop your breast? What is her nutritional status? Are there illnesses around her? So many of these things must be considered. And this is not something you can do alone if you're actually concerned as a mother. I think the right thing to do is for you to see a doctor. And remember, this program is to enlighten you, not actually to prescribe. Well, we are not saying our viewers, we don't see you, we don't see the people we talk to, but we feel you because you are watching us. Thanks for the question, and I believe that you take our advice and then you go see a doctor who will actually find out if this girl is not doing well. If not, they may just have to look at her hormones and some other thing. A question that also have to do with the breast says, what sign could it be when a young lady, compresses her breast and a yellowish discharge is coming out of the nipple? Well, that shows that most likely this person have hyperprolactinemia. A hormone, prolactin, is evidently high. That is why she's not breastfeeding, the breast discharges when there is pressure on it. And how is it managed? It's usually be managed by a gynecologist. But your GP can as well manage this situation. But the first thing it's going to do is to send you to the lab where they will check your prolactin level. He may also ask for a skull X-ray. Depends on what he's thinking. And whichever way, when he places you on medication or on treatment, you will feel better about that. I noticed a fluid-like watery or milky substance in my woman's nipple whenever I touch it. That is hyperprolactinemia. The two questions are actually related, and I'm sure you've noted the answer we gave to that question. My name is Queen. Queen, how are you doing? Our baby is 11 months old. He is not eating but sucking only breast and is losing weight. Please, what could be the problem? The problem is that this baby is underfed. This baby is not nutritionally okay. The breast milk, it cannot be enough after 6 months for a baby. At 6 months, if you have exclusively breastfed, you were expected to start introducing family food or other feeds. So right now, start giving this baby other food. Look for what he or she likes to take. He must take other things. Your child is losing weight because he's not being fed very well. So before he becomes anemic or he become, malnourished, please introduce other feeds. I have a dark patch that itches a lot on my breast. What could that signify? A patch. Do you also have a mass there, or do you feel any swelling in that place? If yes, it's urgent. You must find out what it is. But when you have a patch and the color of your skin have changed, what are you thinking of? That is not how your skin have always been. So why do you wait till now? Let us examine that patch. Go to my colleagues, any of them. They will examine you and then they tell you what kind of patch that is. Someone told me that if you give birth and take a break like for 4 years, it will be hard for you to take in again. How true is this? Juliet from Abuja. Juliet, that is not true. If you decide to give a break for 4 years, it does not disturb your conception, except there are other factors that would have contributed to that. So that is not true. You can always get pregnant when you want to, and it's actually very nice to space your children so that you can recover from the previous ones and then Those ones may even be able to help you in do some things instead of having them too close. It's not good for your health. It's not good for the children. You are not going to have time for all of them. You begin to treat the older ones as adults, whereas they are all children. What is the cause of bleeding after a few days of ovulation? Well, that means around the 14th day of your ovulation, you can actually spot or you bleed. It is as a result of the hormonal difference in estrogen. When estrogen goes up, you can have this form of bleeding. It is not usually serious if the bleeding is not significant. So it happens, it is possible. It only means ovulation bleed or ovulation bleeding. That happens to some women, not every woman. Keep sending in the questions and we will make effort to always answer your questions. And remember that your health is our concern. And that is why we'll always remind you, wash your hands with soap and water. Keep a safe distance. Use face masks when necessary. Until our next episode, I remain your anchor, Clement Edubo.